And most important of all is the choline apnea susceptibility. Obstetric anesthesia and general anesthesia in obstetrics is one area where succinylcholine is used and is very, very useful drug. Even though we give regional anesthesia in 90% to 95% of our cases, you should always be prepared to give a general anesthesia. 1, failure of anesthesia. 2, if the mother does not tolerate it. 3, if things go pear-shaped and there is hemorrhage or there is eclampsia or any other problem. And 4, in any patient that you give regional, you should be prepared for general anyway. And succinylcholine is the fastest acting drug that gives you an access to airway. However, you do not obviously have a reversal agent. Rocuronium is the alternative, but the availability of rocuronium and sugammadex is variable, and henceforth succinylcholine is the most chosen drug. And choline apnea group of patients are common, and henceforth this history is important to know about which group they belong to, and if so, what are your alternatives. You need to be prepared if that lady is going to be on your list or in the labor room. Okay. So, as I said, for obstetric history, the gestational age, is it normal pregnancy or IVF? Then IVF gives you a Hebinger in terms of her hormonal changes. What happens in assisted reproduction? Is it multiple pregnancies? Has she had previous losses? Bad obstetric history? All of that is relevant in terms of what medicines she might be on. Is she got an autoimmune disorder like SLE or Apla syndrome? Is she on low molecular weight heparin? Those things are important in this point. So, what are the indications for specialty referral? So, if the patient is significantly hypertensive, as in hypertensive, severe hypertension or a PIH with impending eclampsia, then you do a quick specialty referral and you decide optimize the patient. Again, with regards to diabetes, there will be a specialty referral. Class 2 to 4, 3 and 4 cardiac diseases, severe anemia, neurological conditions with demyelinating lower motor neuron, pulmonary diseases with severe ones or poorly controlled ones, renal disease with persistent proteinuria, thromboembolism, thyroid disorders, collagen or autoimmune disorders. So, as we mentioned, these are the high-risk category patients who need specialty referral for optimization, and then based on the risk stratification there, we decide where they can be delivered. So, what are the obstetric conditions that might need, a center which has facilities which would be multiple gestations, RH isoimmunization, previous second trimester pregnancy loss due to abruption or, IUD that can be quite traumatic, and you want to make sure that such things don't happen here. Previous preterm, again, the baby might need NICU, so you need a center which has NICU. Abnormal cervical dilatation or effacement, so they can deliver at any point. It can be a precipitous labor or a precipitous and PPH can be common, so you need to be wary about these women.